Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
Hey, Angelique. Now that we're getting to a little more yin time of year, are you doing anything different in your clinic?
No, but I know I should be.
All
What do
right.
you do differently in yours?
I do a couple of things, but what are you thinking about doing for your clinic now that we get a little bit more cool energy? Cool,
Making
dark, and wet.
cool, dark, right. So making sure things are warm and dry, like maybe not treating later into the day. You had
Mm.
mentioned tailoring your schedule so that, as it gets darker, you finish earlier. I know needling technique we were taught in school, like during yin time, generally needling is a little deeper, whereas in summertime it's supposed to be a little more shallow. I'm not sure how that applies with some, if it applies
Yeah.
at all.
Yeah, you could consider that, right? Mostly everything's transverse, so you could go a little
Hmm.
bit deeper in the winter. I usually reserve that for if patients need a stronger stimulation or something like that. I usually go deeper. I don't usually do that for seasonal things, but you
Hmm.
could consider for sure.
Yeah. What else do you do?
For me, I start doing different things in the office, and especially like for practitioner, right? Almost every morning now I make like tongue, sometimes
Mm.
slightly modified, sometimes not. It smells amazing in the clinic. It's nice for me to sip on some tongue all day. I don't know. It just feels right. So a couple years ago. I started doing that throughout the winter, right? Just getting some tongue going
Hmm.
is nice. And then my teacher, Dr. Wu, in the winter, she really felt like Zhang Jibin, right? His like, oh, you got to take really good care of the yang. Yang is a life force. And so she does ginger moxa on the spine. It,
Nice.
it's it's pretty amazing. So usually I don't do too much moxa the rest of the year, but like going into this season right now, you just take a slice of ginger, score it a couple different ways so it has a little bit of juice coming out, especially really
Hmm.
fresh ginger. Put that down the spine, then back up. It really kind of glazes the spine with a whole bunch of
Hmm.
ginger juice, and then because it's Taoist, right? Dr. Wu would always do 7 times down and up, 7 times down and up. Patients find it amazing, and then really uncover the lower part of the body, like so you can get down to the sacrum, right? She really
Hmm.
liked to mox it down the sacrum. Cold tends to congeal lower part of the spine, so especially, you have to lower the patient's pants a little bit to get there. But that's yeah, that's one of the main things I do changing over, right? I start adding a whole bunch of moxa, especially more senior patients, especially more already cold patients, right?
Hmm.
Then I have a whole bunch of patients that are like they don't usually need the heat of supplementing heart, but especially with this season when it goes so cold, they need more outward loving energy. So sometimes I keep this in my back pocket till it starts getting colder, and then those patients start getting supplementing heart, and then I start supplementing more Sanjiao too because of the dark. All
Hmm.
right, the tendency towards depression and things like that. So more
Yep.
Sanjiao. So and then I'm always trying to get rid of damp, but especially when it's really damp, it was really rainy here yesterday. So a lot of supplementing large intestine, lung, and stomach. So, again, it's not a um, purely reacting to the seasonal changes, but for me, that's an important factor for what's going on.
Hmm. And is the Moxa pole? Like she's Moxa pole?
Yeah, I just
Yeah.
use regular. So it's easy, it's relatively quick, accessible, and patients, I mean, they just really love it,
I enjoy it.
especially really cold. And then to put heat, warm, hot, and dry right directly on the yang reservoir in the body. Wow, patients really feel amazing with that. So again, you still have to differential diagnose. I wouldn't do for every single patient, but
Sure.
especially like cancer patients. I have a few fertility patients.
Hmm.
They really feel amazing after that. And I like to reserve it for the winter. It always feels wrong for me to moxa, like say in blazing summer. It just doesn't feel right. But now this time of year, right? Some tongue going in the office and then
Yeah.
clouds of moxa smoke,
That's
it
really
just feels right.
nice. I need to figure out a way to manage smoke in the place where I am. Um, I'm not able to safely open windows. They're really old mill building windows.
Yeah.
In fact, I had one when I started last winter. I was using Moxa on a patient, And the high ceilings that I have were deceptive in that I thought it would just help disperse the smoke, but the room, it was incredible how quickly the room filled with smoke. So when I opened the window, because of how old the windows are, it actually fell back on me. Like I caught it. All right, so just imagine patient on table, the mox is done, thank God, right? And I'm opening the window, and all of a sudden I'm catching this like massive mill building panel. And she's like, "Oh my goodness." And I was like, "Oh my goodness." And I replaced it. We had a good laugh about it. It was probably like, I don't know, my third or fourth patient in the building. Anyway, so I don't touch the windows anymore. But and I tried doing it another time with just Moxapol, and even that fills up the room. So I need to get some
Yeah.
sort of mitigation system going. We used to have these great air purifiers at NISA, so I'm gonna have to ask like what they use because a friend of mine was looking into an actual like fume mitigation system, thousands and thousands of dollars, like
Yeah.
unbelievably expensive. We just need something to just suck it out of the air, real like doesn't have to be industrial strength, but something. What do you use, or do you just open your windows?
Yeah, my windows don't fall into my hands.
Well, that's good.
Uh, when you were talking about that, I imagine you had the Moxa pole burning in your hand as the window's coming. So I'm glad at least you had two hands
I
free.
had two hands, thank God. Yeah, it was a could have been awful, actually.
Yeah, that
Yeah,
that could have been bad.
could have
Yeah,
been bad.
um, how my setup is, yeah, I've got like, especially this seems really good. The rooms either have two windows in them or like right out the hallway, there's another window. So between those
Hmm.
two, it just really, takes 5 minutes. It still will smell a little moxy, but
Yeah,
the major smoke is gone. So
yeah.
that seems to be working pretty well.
Yeah, my goal is to be able to designate one room as like the Moxa room because I've had some patients come through that are really sensitive to scents of things, like any artificial scents or any sort of like really strong scents. So that was my thought is to get one machine to suck out the air in one room or the smoke rather in one room.
Yeah,
Uh,
I think
yeah,
that's
do the
hyper
Moxa room.
reasonable. All right, I was going to ask you something else too. Something I prescribe really frequently, but I'm just not sure how popular it is. Do you ever use Donggui-san?
Donggui-san? No.
Hmm. Do you mind if I talk about it?
Oh, please.
Okay. Yeah, it's a Zhongdongjing, I think from the Jingwei, right? For the chapter, I think it's about like kind of emergency case things for women that are like first trimester and prone towards miscarriage.
Mm,
So it's a great formula, and really simple. That's what I really like about it. It's super simple. Like Judan Shi, the 14th century, one of the fourth great masters, I think probably the most famous of the four great masters. He really likes it because it's got Huang Qin and
hmm.
Baiju in it, which he feels like those are like, historically banned, and I think maybe some modern research, I'm not sure about it, are like really especially good for the fetus. And so it's just really protective for the body, especially if you feel like the miscarriage is due to heat, like this patient I prescribed it for yesterday has got just
Hmm.
so much heat. And so that's a little bit protective to that Huang Qin in there. So it's a good simple formula. Again, since we've been using for 1800 years for, especially for threatened miscarriage in first
Hmm.
trimester or so, I feel like, a lot of confidence in prescribing it. So almost routinely I do that for, especially, usually when I see patients that are going to be first trimester, usually it's status post infertility, and then they've just conceived like this
Hmm.
case yesterday. So
Yeah, yeah.
it's just a nice insurance, nice simple formula, and I think it's not used very often. But anyway, so I just want to mention it.
I remember learning this formula because I pulled up the Eastland Herb app as we're talking to look at it. I
Great.
remember learning about this, and this is a good reminder because I have a patient now that should she conceive would probably benefit from this. Although, so how do you approach this is always one of those controversial topics in herbal medicine. So I've read like warnings around using Dongui and Xuanshang in the presence of a pregnancy because of the moving nature. And so if you look some things up, some things will say not to use them, particularly because I'll do like a Google search to find out like if a patient were to Google this particular herb, what would they see to kind of be prepared. And you'll see that you'll see that they'll say like, this isn't indicated or it's contraindicated. So how do you approach that?
Yeah, I feel like, since it's blood moving, I feel like it's okay, right? I think a little bit of gentle blood moving is good in that kind of case. I would never use like blood breakers, like a Sanlang, a Jew, or something like
Yeah,
that.
yeah.
I'd be hard pressed to use. But I think a little bit of gentle blood movement, like Guizhi Fu Wan, right, with Tao Ren in it, right? That's for fibroids during pregnancy. So I mean
Hmm.
that's Tao Ren's so much stronger than Donggui and even Chuan Qiong. So I feel like. Yeah, I think it's okay. And again, like if I was building a formula myself, I think I
Hmm.
just would avoid these. But especially with so much use for almost 2 millennia, I feel like okay, this has definitely been a identified problem, and 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 patients have benefited from this, right? Otherwise, it would have been discarded long ago. So I feel like it's yeah, moving a little bit of blood in the lower part of the body. I think it's you should be cautious with that, but I think it's really helpful.
Do you stick generally to the traditional proportions of the herbs?
Yeah, that like this one, it depends upon if I'm making raw formula
Mm.
or like this one I prescribed yesterday. It's from Classical Pearls makes it Donggui-san, and then Heiner Fruhoff again, who sources all that. He gets a special. I forget exactly the Donggui, but especially this is more protective than being a problem during pregnancy too. Again, I forget the details about, it, but he sources it from a certain area uh, that has the terroir that's correct for it or something. Again, it's nice to just refer to Heiner Fruhoff figuring all that out and then just be able to prescribe it with confidence.
Yeah.
But yeah, almost every patient that I've gotten that's infertility that conceives, almost everybody I go to Donggui-san, maybe with a combination or something else. This
Hmm.
patient yesterday, just by itself.
Cool. Thank you for the reminder about that.
Okay, sure, yeah. Again, it came up yesterday, so I was thinking about it.
I have the current herbal conundrum that I have that I am fully unprepared to discuss fully, but just in general, the one thing I've had a couple of mixed heat and cold patients. For example, one has a history of endometriosis, craves warmth in the lower uterus, like in the uterus area all the time, just craves warmth. Like when it doesn't matter, middle of summer, wants warmth there. So I have a heat lamp that usually I'll use
Mm.
that. But the rest of her body can get very hot. I had her try Wenjing Tong just to see, I had a patent and I had her use like small dose Wenjing Tong just to see. And I'm glad it was small dose because she had a very, very much flare of the heat
Mm.
symptoms. And so I was trying to discern because I was looking up like why these sorts of things happen. And one of the things I found, referencing back to one of our classic texts, as I said, I'm not fully prepared to like have discourse, but it was something along the lines of basically when you move cold that's been there for a long time, that cold is covering latent fire. And so you could have a rising of the heat symptoms. So I was trying to discern whether that was that or whether the herbs were just too warm for her in the setting of having heat in other parts of her body. Like a lot more heat above, but she also had some heat below. Like she had some damp heat in the lower burner symptoms as well as cold in the uterus. So that's tricky. I'm trying to figure out a formula for her
Mm.
to take those two things into consideration.
Yeah, usually I do that kind of mix things more with acupuncture, but for herbal medicine, right, I would consider, especially since more heat presentation, maybe
Yeah,
clear the
clear the
heat
heat
first
first. Yeah, that was
and
my,
then go after the cold. That
yeah.
that's probably what I do. But
Yep.
again, it's difficult, right? Because that kind of mixed
Hmm.
presentation, right, you have to be careful.
Thankfully, they're a good sport and open to trial and error, so that's good.
How do you research, like you were saying before you research that, you started to research that? What's your go-to like resources for that kind of stuff?
So I have on my computer a bunch of Chinese medicine ebooks. So I will open and search. I've got uh, a big red one. It's by McLean and Littleton. It's their main manual of internal medicine. I think it
Hmm.
might even be like the Clinical Handbook of Internal Medicine. I have that as an ebook format, and so we'll frequently look that up. Um, I have started using ChatGPT. I've uploaded a bunch of the books that I have to it and have it search for me. That's been helpful. That found the quote from the classics because I had a couple of PDFs of, I think I have one version, I think of this, I think I've got both the Suan and the Ling Shu on there. Anyway, so I had to look up references for that and then went back to them and was reading about that.
Hmm.
Those are my two main things. And then I'll bust out books that I actually have that I think and like physically look through.
Hmm.
But my
You
go-to
look
is usually the ebooks first with a search function.
you're looking for symptoms, or what are you searching?
I started with I did a heat above, cold below search. And then I'll look at and like I'll look at Western, say I'll do endometriosis, um, herbal formulas. Like I'll still search for herbal formula. And then if I'm not quite sure, that's when I'll go to the actual physical book and look at their table of contents and then start searching by condition. Like I'll look at different conditions. Yeah. So that's how I've done
That's
it.
great.
Do you
That's
have a more
great.
refined approach?
No, that's sometimes also I reach out to mentors, right? So that's still what I
Oh,
do.
yeah.
So because again, I feel like a little bit disconnect when I look at just texts, right? Because I feel like they didn't have to prove anything. Like especially I look at like Macchiocha texts or something like that. I feel like they didn't have to prove anything. I spent my first like year or two in practice looking up. They still have gold Macchiocha, right? It's the really thicker one. It's more
Oh,
for
that's
clinical.
version two.
Yeah, so I
Yeah.
would look through that and then it just never worked, right? It never worked, that kind of thing. So I try and reach out to actual clinicians. That's one of my main things I like to reach out to. I have a couple of people that do derm. I meet with my teacher, Dr. Wu, once a week. I really try to, I don't know. I feel like I reach out more to practitioners, but I used to more look to books. So I was just curious about your thing.
Yep. I'm definitely into the books realm.
Yeah.
I mean, this is probably blasphemy, but I don't love the Machiocha reference books for the reason that
There's,
you're saying.
yeah.
It's a little bit too dry. The other book the McLean and Littleton book has a bit more in-depth discussion about each. Yeah.
Yeah. I'm not sure if that's blasphemy, but that's my experience too, right? Is yeah, that's a little bit more textbooky theoretical
Hmm.
things, and
Yeah.
then but I think it's so great to talk to clinicians that have seen 10,000, 30,000 patients, right? What do you
Yeah.
do in this situation, right? Then that's I don't know. I feel like that's better, and then more interactive too, because otherwise you're reading the book and you have like further questions and things like that. So, anyways, that's I feel lucky to be able to reach out to mentors and things like that
Hmm.
now. But that. Anyway, that's my most reliable research now.
No,
And
that
then,
makes sense.
especially now, it's dec 2.5 decades in, right? So now I have less questions too. That's just always kind of nice, right? Then
It
I
must
kind of
be
draw,
nice.
well, I just draw on my own experience a little bit, right? So that's something to look forward to.
Hmm. I look forward to it very much.
All right, what else is on your mind?
I had I've had several new patients come through. Like I'm now hitting an uptick again, so I'm seeing 20 plus patients per week now the last few weeks, which is nice.
Hmm.
And so one of them, I so like it was handing the Sanjo excess to me just like on a platter. It just unbidden sitting there doing the intake and I had no intention. It was a very brand new patient and I don't, you know how I am now with like haven't fully, been super brave about doing first patients with some, but I'm thinking, I'm like, oh, so she was just, big, bright blue eyes, very sensitive, very polite. Talked about how like hot and flushed they get in the upper body, and how they have just like profuse sweating, but then also have like a really hard time regulating their temperature. Like sometimes they get really cold, and she's like, yeah, and when I get these, like, she gets these migraines, and it happens on her left ear. And she's like, as a matter of fact, it's the left side of my body that just gets everything. And I just was like checking off the
Ugh,
boxes.
my needle
And
finger's so itchy.
yeah, I was like, so, so then of course I don't know, I was feeling a little cheeky that day. So I was like, tell me where I'm wrong. I was like, do you just love a rainy, cloudy day? It's just like kind of drizzling. She's like, yes, I absolutely love those days. I was like, good, good. And I was like, and when people are, kind of impolite and not thoughtful, like how do you feel about
Mm.
those kind of people? And she's like, I can't stand it. It's awful. And I was like, okay, so I do this kind of acupuncture. And I explained it and I did it. And she said something interesting that I had never heard before. Um, she tolerated the insertions well. I didn't prepare her for, I didn't preamble because I stopped doing that. And she's like, the first one, it was like, oh, that's a lot. She's like, but the other three at the end of each time, it was like happiness.
Mm.
Yes. I was like, wonderful. I'm so glad. Yeah.
If only all patients would be like that.
Yeah, it was great. I was like laughing internally the whole time. It was as if she was like reading the book to me and just like reading off all of the things that could possibly have been.
Yeah,
Yeah.
so sometimes I feel like that when patients come in, I'm like, oh, come on.
Yeah. Well, that's the first time it was so obvious. I'm like, please do this every time. Send all of these people to me who just are very obviously one symptom, like one channel excess. Thank you. Thank you very much. And then she loved it, which is good.
That's great.
And I had another
Wh-
patient come in too, who had had some from a previous acupuncturist years ago, also a constitutional Sanjiao excess. That, and I was talking to them about the different kinds of acupuncture that I did not want to even consider SOM at that time because they said that when they had it, when the liver supplementation was done, they always felt great. But if any other channel was supplemented, they would feel worse than when they came in.
mm.
So they were feeling really reticent about trying it.
Yeah, again, I can certainly understand that from patient's perspective, but especially if you
Mm.
know that practitioner and you could reach out to what they did, the other channels, because you could just do the reverse of all those other
Right.
channels they've
The
taken,
wonky ones.
right?
Yeah.
Because for sure that'll be right then, right?
Yeah.
Because patient response is the most guiding thing that we have. So I can, from the patient perspective, I can certainly understand that, but actually you got a lot of keys to the kingdom from that information if you can get it.
Yeah. I'll have to think about it.
Okay, yeah,
Yeah. Those are the main rise to the top
great.
stories from my week.
Where do you think that uptick's coming from?
I don't really know. Um there's been more word of mouth that's happened. I don't know how much spiritual waxing we want to do here, but I sort of released my death grip on the need for more people. It was sort of along the lines of what we talked about in one of our previous episodes where I was trusting the medicine, and I'm not sure that I articulated that the way that I wanted to. In trusting the medicine, it's like knowing that it will work. Like you will put the needles in, you will do, and it will do its thing. Like when you've diagnosed, it's like trusting that this system will work. And it was along those same lines of I sort of released that like fearful grip of, oh my God, what if the patients don't come? And at least for the moment, a few episodes down the road, let's see where we are. But at least for the moment, I've kind of let that go. And in that letting go, all of a sudden, all of these people have appeared, all of these new people, and people telling me that they're referring their partners or their friends, and then people are actually coming. So that's been an interesting experience and a lot less stressful for me. I just sort of like surrendered to the process, I guess. Yeah.
That's fantastic. My teacher, Dr. Wu, she'd see 150 patients a day, right? So the most successful acupuncturists I know in person, right? And
Yeah.
she always says, patients stop coming when I stop doing my homework. And I was like, even you? She said, yeah. If I'm not doing it, like you're saying, just trying to do that self-cultivation, like I've got to release this death grip, right? And then you do it,
Hmm.
and then patients come. So that was her experience. That's my experience. Sounds like that's your experience too, right? If as long as you do your homework, patients will come.
See,
Something
I
they can
took
just,
that to mean literally, Toby, like doing my homework, like going home and hitting the books.
yeah, that she wasn't talking about that. She's a Taoist, so book cultivation's part of it, but self-cultivation is the major part of it.
Okay. I like that way better because I put myself through too much homework as it is.
Okay. You know that Taoist saying, right? If you seek knowledge, right, try and gather something every day. If you seek the Tao, try and lose something every day.
Yeah.
So that's she's more the lose something every day, right?
Yeah.
Again, that loosen that grip, right? And then
Yeah.
patients recognize that energetically, and then they tend to come
It's
again because
wild.
you'll be a much better practitioner for them, and so that something about they just get tuned up with that.
Yeah, it was a profound. I had a dip. Goodness, who knows? A few weeks ago, I had a dip below like where my minimum. I think it was like a dip below 15. I think I had like 13 patients one week, and I was all in like a pit of despair, and trying to remind myself what you had said that things things, people come and people go, but going down the negative self-talk, like I just must be terrible, and then just being like, cut it out. I don't know. I had a moment where I was just like, well, this is going to be what it is, and it's going to be okay, and the people who are going to find me are going to find me, and I connected with that in a way I hadn't before, and I felt something shift inside of myself, like just relax, and I have the last couple few weeks have been able to maintain that relaxed position and people like I have a voicemail on my phone like right now that I got before coming to do this with you, that of another patient wanting to be seen. So it's neat.
Yes. I told you soon this is going to be a problem managing all the patients that are coming.
So far, no, but
I know,
you
but
know,
I'm saying that's gonna be a new problem. You're
I'm
gonna be
holding you to it.
now you're letting the death grip go into you're gonna have to be like, okay, how am I gonna manage all these people?
I'll put the death grip back on. No.
That's right. Maybe
Yeah.
yeah, release your cultivation and pull back. Yeah,
Yes.
that might be a way to manage it.
That might be. I
I'll,
don't feel
I'll
that that's good.
I'll run that by Dr. Wu and see what
No,
she has
please
to
don't.
say.
No, do not. No, no.
All right. Anything else for today? Anything else pressing?
I don't think so. Anything for you on your end?
I've got always got tons of things I want to talk to you about, but let's leave it for next time.
Okay.
Uh, Remember, coming forward, our next episode, we're going to have our first guest, so
Oh
I'm
yeah,
looking
that's
forward to that.
right.
And then I'm going to put up on the screen here the email to get in touch with us if anybody wants to contact us about questions and things like that,
Hmm.
or ask us about anything. So I'll put that up here. I've been neglecting to say that, so I want to remember to. I'll put that on the screen right here.
Awesome.
All right. All right. Let's leave it here for right now. It's always
All
nice to
right.
see you, Angelique.
Nice to see you too. We'll see you next time.
All right. Bye, everybody.